Well, in this week's Cardiology Countdown, we'll start with a paper published in JACC this week on hostility and the risk of coronary disease. This was a prospective study done in Canada and Nova Scotia, where they did, amongst other things, a stressful interview looking for responses to that, and found that patients who demonstrated outward hostility had a twofold higher risk of developing coronary events over the next 10 years. And so this, to me, was a good reminder to remain calm, and that can be one way to potentially avoid coronary disease. At the number 2 spot is a study announcement made as a press release regarding the SATURN trial. This was a study announced by AstraZeneca, led by Stephen Nichols and Steve Nissen, doing IVUS over a 2-year period in patients with coronary disease, comparing rosuvastatin 40 milligrams and atorvastatin 80 milligrams. The hypothesis was that with the slight advantage on HDL raising and potentially a little more on LDL lowering, that there would be better regression or less progression with rosuvastatin. The announcement was that the primary endpoint was not met, and there was not a statistically significant advantage for rosuvastatin 40 milligrams. This has implications since atorvastatin will go generic in mid-November of this year, and so we'll see the full results at the AHA meeting as a late-breaking clinical trial. And at this week's number 1 pick are 3 new ESC guidelines that were released at the ESC meeting. There were guidelines on cardiovascular disease in pregnancy, peripheral arterial disease, and an acute coronary syndromes update. There are lots to be reviewed, and we'll have 10 points to remember from each of these. From the acute coronary syndrome one, there were many new additions, including coronary calcium scoring and a CT angiogram for ruling out acute coronary syndrome in low-risk patients. There was also discussion of the fact that the high-sensitivity troponin has introduced into practice, and still some issues being worked out there. In the therapeutic area, there was also the addition of ticagrelor as a class 1 addition, and notation that prasugrel has also been an option for PCI. There are also details on timing of angiography incorporating the latest trials, and reminders of lifestyle and drug intervention for long-term secondary prevention. And so a very nice comprehensive guideline for acute coronary syndromes, as well as these other 2 on PAD and pregnancy. And so for this week's Cardiology Countdown, I'm Chris Cannon.